Hi, I'm Dr. Priya Matthew from MVP Family Dental, and I get a lot of questions about dental crowns. So today I'm going to address those questions, and I hope that they help you understand dental crowns more clearly. Dental crowns are a way to restore your teeth. They cover the tooth and they protect it from breaking. Some alternatives to dental crowns could include inlays or onlays, which are made out of similar materials, but they look more like fillings. There are full coverage dental crowns. There are partial coverage dental crowns. There are veneers, which are kind of like partial three-quarter crowns. So there's a PFM crown, which is a porcelain fused to metal crown that is kind of like an older way. We used an older material for crowns because the downside is that the porcelain would chip. The upside was that the metal was strong. So nowadays we use a stronger material that looks like porcelain. It's called zirconium. That's what we use for most of our dental crowns, and it's very strong. It's very high strength, so it can stay in the mouth without breaking, but look like a tooth. There are also aesthetic options that you can use in the front of your mouth, different materials like lithium disilicate. And a dental crown is necessary after root canal treatment, especially in the back teeth, including the premolars and the molars. In the front, sometimes if it's a small access to get into the canal, you don't need a full crown. But in the posterior back of your mouth, you definitely need a crown after root canal. The dental crown procedure starts with the doctor getting you numb, and we basically take out the old filling, or if there isn't an old filling and there's some decay, we remove all of that. And then we fill the tooth in with what we call a buildup, which is just a fancy way of saying a big filling. And then we prepare the tooth for the crown by removing about 1.5 millimeters to 2 millimeters all around the tooth. So on the sides, on the top. And this is going to make room for the permanent crown to cover the tooth and have enough thickness for the material to not break. Then we take a digital impression, which is where we scan your tooth intraorally with a digital scanner, so you don't have to go through the goop of like a regular impression. And then that gets sent to the lab. And in a couple weeks, well, you leave the office with a temporary crown. And then in a couple weeks, you come back, we take off the temporary crown, we put on the permanent crown, make sure it fits, check the bite, make sure you're comfortable, and then you go home. A dental crown placement does not hurt. We will get you numb if you need to be numb for that procedure. Some people are totally fine without getting numb. We ask you and we make sure you're comfortable during that procedure. There are no bad consequences of getting a tooth crown. I mean, you might need to get it replaced in 10 years, just if you haven't been taking care of the crown. You do have to still brush it and floss around it and make sure your gums and your tooth around it are staying healthy, so you want to keep up with your dental checkups. You can put children's teeth in crowns, but it really depends on the status of their teeth. I mean, if they have a really deep decay and they need to get what we call a pulpotomy, which is kind of like a baby root canal, where we remove the nerve of the tooth, the baby tooth, then the tooth would need what we call a stainless steel crown, and that is to protect the tooth from further deterioration. But it really depends on what the cavity status is of the child. Crowns in adults look like normal teeth, and the front ones we really match well with the rest of a person's existing teeth. So we select the shade and we try it in before we cement it in permanently. And in the back, same thing. We make sure that the shade is a good match, and it looks basically like your regular tooth. You can get cavities under crowned teeth at the margin of the crown, which is where the tooth meets the crown. If you have some recession of your gums and that is exposed, that area of your tooth is exposed, and you're not keeping it clean, then it is possible to get decay there. You should brush and floss like you normally would your natural teeth. It's going to act like a natural tooth. So you want to keep it clean and do your regular checkups. A dental crown should last at least 5 years to 10 years to even longer, as long as you're taking care of it and coming in for your routine checkups. Most dental insurances do cover dental crowns. They don't cover it fully, and it depends on your dental insurance. So when you come in, we'll take a look at your insurance and see what benefits you have, and we would see how much it would cover for your crown. You can schedule an appointment for a dental crown by calling us at MVP Family Dental. The phone number is 215-887-7171. You can also reach us through our website, which is mvpfd.com, and follow us on our socials at MVP Family Dental. I hope we've been helpful with you learning more about dental crowns. But if you have any more questions, we're here to help. So give us a call at 215-887-7171. Thank you.